of the models the White House is using to make those guidelines is from an independent researcher from the University of Washington. As of today, the Institute for Health Metrics and Evaluation predicts that the number of deaths will peak in the U.S. on April 16th, with more than 2,600 deaths per day. It predicts 0 deaths by July 16th. In Washington state, researchers believe deaths will peak around the same time, with 23 deaths per day. They predict no new deaths here by July 2nd. KIRO 7's Simni Kim is at the live desk now to break down some of those numbers.
IHME started their work to help hospitals prepare for the surge of COVID-19 cases. It's one of the models that influenced the White House's decision to extend the national social distancing guidelines through April 30th. But there are other scientists who raised some doubts about the model. Healthcare workers across the country are ramping up for a surge in cases of COVID-19. And according to this model by the Institute for Health Metrics and Evaluation, hospitals in the U.S. will reach their peak on April 16th. It also projects the country will be short more than 84,000 beds, nearly 39,000 of them for the ICU, and more than 31,000 ventilators needed. By August, the models show we could see nearly 94,000 people dead from COVID-19. Chris Murray, IHME's founder, discussed his data on CNN.
We're trying to help hospitals plan for the surge, and so we've trying to say this is what we think is most likely to happen. And so to do that, we've assumed that all the states that don't yet have stay-at-home orders in place will do so within a week.
But it's a big assumption. Several states still don't have stay-at-home orders. That's one of UW biology professor Carl Bergstrom's main concerns about IHME's projections.
I think there's an absolutely key thing we have to understand about that model, which is that it's really a model of kind of a best-case scenario in which we're successful at suppressing the pandemic and we're able to bring that under control through social distancing measures.
In Washington state, IHME researchers forecast hospitals to reach their peak resource on April 15th, with a need for 26 more ICU beds and nearly 300 ventilators. By August, the death toll is projected to be at more than 1,200. IHME researcher Ali Mokdad also appeared on CNN. He made clear that social distancing is key.
It could go higher if people do not adhere to these stay-at-home orders, and it could go down, of course, if people do stay at home and they apply this social distancing in their daily life.
It's important to note that IHME's models change daily as new information comes in. The models also assume that states keep their social distancing guidelines in place through the end of May. At the live desk, Simni Kim, KIRO 7 News.